We're a collaborative of people interested in protecting the mental health of essential workers. We work in various areas: public health, trauma-informed care, mental health, HR and occupational health. A moral injury is a particular kind of distress caused when you are troubled or upset by actions of yourself or other people that go against your values or what you consider to be good practice. The distress caused by moral injury isn't pleasant, but it doesn't necessarily go on to cause longer-term problems if we can act early to make a difference, or if we can find a way of making sense of it in our minds.
We organised a survey of local essential workers to explore their experiences of moral injury and what they felt would help. We had 566 responses from the NHS and health sector, from local government, education and childcare and other sectors. Just over half of respondents were from the NHS and health sector.
Generally, people who filled in the survey were much more troubled by the actions of other people than they were of themselves. There was a small proportion of people who were troubled by things that they had done themselves. People feeling more moral injury also reported lower mental and physical well-being. They also reported feeling less connected with colleagues. This is important because support from others during difficult times really makes a difference to our well-being over time.
Staff shared experiences of what had troubled them and what they felt would help. We've been sharing these with organisations and looking at what else we can do to reduce moral injury. There are also things we can all do to help ourselves and others.
Supervisor check-ins. Some staff were upset that they or colleagues had not been contacted by their managers or supervisors. Suggestions included regular supportive check-ins with managers, informal team meetings and access to mental health support. One practical action everyone can take is to plan it out. At what point this week are you going to let someone senior know what you or your colleagues may need for them to function well? If you are a manager, how can you ensure that those working from home or off sick are contacted, feel valued and are still a part of the team?
Encouraging kindness. Some staff reported receiving verbal abuse from colleagues due to their own stress levels, being told off for raising serious safety concerns, and also a public perception that nurses are carrying disease. Suggestions included educating the public, challenging toxic behaviours within teams, and support for senior staff to manage their own emotions. It was noted that a command and control approach needed to be balanced with kindness and compassion. To promote kindness, everyone could consider, what one small thing can you do today for one other person that would help them feel supported and connected?
Enforcing the rules fairly. Some staff reported feeling worried or angry or frustrated about rules not being followed. Sometimes it was their colleagues, sometimes those in authority, but they felt strongly that the guidelines should be enforced where possible. Staff asked for fair, reasonable guidelines and maybe even spot checks to make sure that they were happening and to find out what could be done if those rules were broken. Some staff were concerned that they had been asked to go into base when they felt that they could work from home. They felt that that had put themselves and their family and perhaps other people at unnecessary risk of harm. However, other people noted that some home working had added an additional workload to those people whose roles couldn't be done from home. There was a mixture of opinion between some people saying that individual needs needed to be taken into account and others saying that rules needed to be applied universally. One thing we could consider doing is having more conversations to better understand each other's needs and values and circumstances, is to try and fairly follow the guidelines and practices as set out to keep each other safe.
Peer communication, feedback and response. Some staff felt immense guilt for not providing face-to-face care and asked for the flexibility to offer care based on the needs of the client where possible. Some redeployed staff felt very uneasy that they'd been asked to do things they hadn't done for many years. Staff suggested more planning and training. They also asked for better communication and more choice of where they end up, as well as more notice of any change in role.
This is just a snapshot of the findings, and more detailed data can be found on the Recovery College online website. If you are from the North East, public sector staff can access further help by dialing 0191 223 2030.